This video is designed specifically for people who have group insurance as an option when they turn 65. We're going to talk about how to apply for Medicare, which parts of Medicare to apply for, and how Medicare Parts A and B work. This is a picture of a Medicare card. As you can see, it is red, white, and blue. It'll have your name and your Medicare number on it. Now, if you're already receiving your monthly Social Security check, this card will be sent to you about 90 days before the month that you turn 65. Medicare starts everyone on the first day of the month in which they turn 65. So, if your birthday is May the 24th, then your Medicare benefits will start May 1st. However, if your birthday happens to be on the first day of the month, they'll actually start your Medicare benefits 1 month early, which in this case would be April 1st. If your card says Hospital Part A and Medical Part B, and you want both of them, then you should be all set. However, if you only want Part A at age 65 and you want to postpone Part B, for example, maybe you've got group insurance, then just follow the instructions that come with your card. You can return it to Social Security and they'll send you a new one with only Part A on it. If you're not receiving your monthly Social Security check yet and you want to delay signing up for it, you still need to enroll in the parts of Medicare that you want. You can apply for your Medicare benefits in one of three ways. Online at ssa.gov/benefits/Medicare. You can call Social Security at 800-772-1213, or if you're feeling real adventurous, you can visit your local Social Security office if you have a couple of extra hours to spare. This is the picture of the cover of the Medicare and You book. It's really like an owner's manual for Medicare, but just like the owner's manual that you probably didn't read for your vehicle, you're probably not going to read this Medicare and You book either, which I understand. It's about 120 pages long, and most of what's in there probably doesn't apply to you. So I'm going to do you a favor. I'll answer the most common questions that I get regarding Medicare, and I'm going to reference the Medicare and You book. When I get to something that applies to you, just pause the video and make some notes. I'm not going to read these pages to you because I don't want to waste anyone's time. Most people are eligible for premium-free Part A. In fact, in my 35 years, I've only dealt with 6 people who didn't automatically qualify for premium-free Part A. So when I say most people qualify for premium-free Part A, I mean most people. There's no drawback to signing up for Part A unless you're still contributing to an HSA, which is a health savings account. More on that in a moment. Now, the most common question I get from people who are turning 65 who have group insurance is whether they need to sign up for Part B of Medicare at age 65 or whether they can postpone it. This is a really good question because if you can avoid paying $144.60 a month premium, if it's not necessary, then that's a good idea. So, should you get Part B? If you're not sure, let's start with this. The most important words on this slide are the first 3 sentences. If you or your spouse are still working and you have health coverage through that employer, now let me repeat, is still working, then it might be to your advantage to delay your Part B enrollment. These are examples of the types of health coverages where you should sign up for Parts A and B because they're not considered to be, quote, still working under the previous slide. If you don't sign up for Part A and B and you're covered by these, you risk paying a penalty of late enrollment. Let's talk about group insurance. The next slide only applies if you have group insurance. These are questions to ask your company's Human Resources Department or their insurance rep. The answers will help you understand whether you should keep your group insurance or not. For example, I spoke with a guy who can keep his group insurance when he turns 65. His premium will be around $400 a month, just for him. He has a $3,000 annual deductible before any benefits are paid, and he doesn't take any expensive prescriptions. So I recommended that if he signed up for Parts A and B, yes, Part B will still cost him $144.60 a month, but he wouldn't need his group insurance if he bought a supplement to Medicare, which would cost him about $100 a month. His prescription drug coverage will cost him around $17 a month. So if we add that up, for about $250 a month, he would have great health insurance with only a $198 deductible on his medical bills. And that's a calendar year deductible. Here's my point. Don't automatically assume that because you're eligible for group insurance that you should definitely postpone Part B and stay with your group insurance. The questions on the next 2 slides will help you figure out what's best for you to do. If you're on group insurance, go ahead and pause. Same here. Go ahead and pause. If you have TRICARE, you generally want to enroll in Parts A and B at age 65. If you have coverage through the marketplace, you should sign up for Parts A and B at age 65, because once you become eligible for Part A, you'll no longer be eligible for any of the subsidies that you may have been enjoying as a member of the marketplace. And I told you we'd have more on the HSA. Here it is. If you have an HSA, go ahead and pause. Now, this chart is called the IRMA chart. IRMA stands for Income Related Monthly Adjustment Amount. The idea behind this chart has to do with how much you're going to pay for your Medicare Part B premium based on what your income was 2 years ago. So this has to do with income in 2018. You can see if you're an individual and you made more than $87,000 in 2018, or if you're married and you made more than $174,000 in 2018, you'll pay more for your Part B than everyone else. Now, let's talk about Part A of Medicare. This takes care of you when you are in the hospital. Medicare is going to pay the entire hospital bill except for the first $1,408 deductible. Now, if you're unlucky and you have multiple hospital stays in the same year and they're separated by more than 60 days, you'll owe that deductible again. In fact, if you have poor timing and bad luck, you could actually pay that deductible 5 times in a calendar year. Part B of Medicare. This is the one that's optional. Most people pay $144.60 each month. For your medical bills, Medicare says you have to pay a calendar year deductible of $198. After that, Medicare is going to pay 80% of the approved amount, and you would pay the other 20% of the approved amount plus any excess charges. Now, the most important thing to realize about Medicare Part B is that your 20% share does not have a cap. Most of us are familiar with insurance where our 20% share may be capped at $1,000 or $3,000 or $5,000. But with Medicare, your 20% share is unlimited. So if you had a $40,000 or $50,000 worth of medical bills, that 20% share can run into the thousands of dollars rather quickly. Our final slide covers Part D, which is the prescription drug part of Medicare. We're not going to spend much time on this because I'll have a separate video covering that. Briefly though, Part D is a partnership between the Medicare program and private insurance companies, and there are about 30 to 40 different plans available in most states. The simplest way to choose the best plan for you, which would be based on the drugs you take, is to go to medicare.gov and click on Drug Plan Finder. Now, I've done my best to give as much pertinent information as possible, but please understand, with over 3 million people turning 65 this year, it's virtually impossible to answer everyone's question in this format. So, if you have a question, feel free to call me at 800-465-3164 or visit our website. Now, by this time, you should have a good idea of whether you want to keep your group insurance at age 65 or whether you'll need supplemental coverage. So that's what our next video is going to cover. We'll discuss the differences between original Medicare and the alternative to original Medicare called Medicare Advantage. If you have questions or comments, please put them below. Please subscribe so you'll have access to all the videos in this series. And finally, please share this video with anyone you know who could use this information. Thanks.